Assalamu alaikum warahmatullah. Today we are going to discuss how to approach a case of neck lamp in MRCDPS exam station 5. Um, if the scenario of the case is neck lamp, you have to put in your mind even before going to inside to see the patient that this patient is either a case of Graves' disease or lymphadenopathy, nothing else. Graves' disease is the more frequent case in the exam. If it is neck lamp, it is most likely to be a Graves' disease and less likely to be lymphadenopathy. But you have to put in your mind lymphadenopathy as well. Because some candidates are dealing with a case of neck lamp as a case of only Graves' disease, and he's not putting in his mind that it's a case of lymphadenopathy at all. And at the end, the case would be a case of lymphadenopathy, so he lost all the case. So neck lamp means Graves' disease or lymphadenopathy, even if you didn't see the patient yet. Most probably it is a case of Graves' disease that we are going to discuss today and to approach today. We know that station 5 is 10 minutes, 8 minutes with the patient and 2 minutes with the examiner for discussion about the case. Differential diagnosis of neck lamp would be the form of lymphadenopathy, which is the most common, not in the exam, but in the public, or most common case of neck lamp all over the world. It is lymphadenopathy. 80% of the neck lamp is because of lymphadenopathy. Graves' disease, solitary nodule, multinodular goiter, thyroid adenoma, and thyroid cancer. But in the exam, like we said before, most probably it will be a case of Graves. But you have to put in your mind as well, maybe a case of lymphadenopathy. Don't forget this point. As we know that station 5 is a case of a focus history, focus examination, and to reply the patient question in the um, 2 minutes, in the 8 minutes. The history, like annals of any complaint, the onset of the neck lamp, the course, the duration, the progression, if this neck lamp painful or not, associated symptoms, which are the compression symptoms. Very important to ask about the compression symptoms. Why? Because this patient, if he has compression symptoms, he has to be referred urgently to a surgeon. Compression symptoms, uh, shortness of breath because of tracheal compression, change in the voice character because of vocal cord involvement, difficulty of swallowing because of compression of the esophagus. Any other lumpus or bumps in the body to exclude generalized lymphadenopathy for the patient. Then ask about the symptom systemic review of the patient, which are hyperthyroid symptoms, hypothyroid symptoms, eye symptoms. Okay. Why I'm asking about hyperthyroid or hypothyroid? We know Graves, most probably it will be hyperthyroid, but this patient may be post radioiodine therapy. So post radioiodine therapy may be hyperthyroid or hypothyroid or even euthyroid. We cannot guarantee that the patient is hyperthyroid. He can be hypothyroid or can be euthyroid. Graves with euthyroid post radioiodine therapy. So we have to ask about hyperthyroid symptoms in the form of any hot intolerance, any loss of weight, any increased appetite, any racing of heartbeats, any checking of the hands, any sweating, any anxiety, any loose motions. What about the periods of female patient? Hypothyroid symptoms, any cold intolerance, any weight gain, uh, any bad mood, dry skin, constipation. What about the periods of female patient? Eye symptoms. We know that Graves has a triad of Graves ophthalmopathy, pretibial myxedema, and thyroid acropathy. So, eye symptoms, we know that Graves disease can be associated with uh, ophthalmoplegia اللي هو external ophthalmoplegia or optic nerve compression or maybe keratitis. So you have to ask about any double vision, any painful eye movement for Graves' ophthalmopathy. Here, here lymphadenopathy symptoms. Don't ask about lymphadenopathy symptoms and differential diagnosis if the case is very clear for you in front of you that the patient has thyroid limb and he has Graves' ophthalmopathy signs in the form of lead retraction and exophthalmos. So don't ask about lymphadenopathy questions. We will ask later in other case of lymphadenopathy NICLAM because of lymphadenopathy. We'll ask later and we'll discuss in detail the differential diagnosis. So no need to ask about lymphadenopathy of loss of weight, nocturnal fever, itching, coughing up, blood contact with TB patient. All of these can be asked if you are not you are suspecting lymphadenopathy for the patient. But if the case is clear for you in front of you that the patient has NICLAM and has a thin patient and has exophthalmos, for example, so it is a clear case of Graves' ophthalmopathy. No need to ask about lymphadenopathy symptoms. Then social history. Like all the cases of station 5, station 2 and station 4, 4 question has to be asked. What the patient job and how much the symptoms affect his job and usual daily activities. Refer the patient to social worker if his usual daily activities are affected. Refer the patient to occupational health care if his work is affected because of the symptoms. With whom the patient is living and who is supporting the patient at home. Financial support. Do the patient smoke at all? Do the patient drink alcohol? Smoking here very important because it can worsen his ophthalmopathy symptoms. Medical history. Any long-standing disease like diabetes, hypertension, cardiac problems, surgical operations, any family history of similar problem or medical disease. What about your drug list? Ask about the concern after approaching your examination, doing the focus examination for the patient. So again, very simple case to approach in the history. When this NICLAM started exactly? Is it increasing, decreasing, or the same? Is it coming on and off or all the time with you? Is it painful at all? Then compression symptoms. Do you notice any shortness of breath, any change in your voice, character, any difficulty with swallowing? Any history of lumps or bumps on the body? Hyperthyroid symptoms. Any hot intolerance, loss of weight, increased appetite, racing of heartbeats, hand checking, sweating, loose motions, and anxiety. What about your periods if female patient? Hypothyroid symptoms. If you have hyperthyroid symptoms are positive, so no need to ask about hypothyroid symptoms. If the hyperthyroid symptoms are negative, so ask about hypothyroid symptoms. Any cold intolerance, any weight gain, any bad mood, constipation. What about your periods? Eye signs or eye symptoms, sorry. Any double vision, any painful eye movement, any eye redness for Graves' ophthalmopathy. No need to ask about lymphadenopathy symptoms as we said before if the case clear in front of you as a case of Graves' ophthalmopathy. Social history. And what about your job? What do you do for a living? How much do the symptoms affect your job and usual daily activities? I'm sorry for that. I'm going to refer you to a social worker if your usual daily activities are affected. I'm sorry again. I'm going to refer you to occupational health care worker to give you the full care regarding your job if the job is affected. With whom you are living and who's supporting you at home. What about your financial support? You smoke at all? You drink alcohol? And at that point, advise the patient to stop smoking because the smoking may worsen his condition or his eye problem. And we can refer you to a cessation clinic, to a smoking cessation clinic to help you with this issue, if you don't mind. What about medical history? Do you have any long-standing disease of note like diabetes, hypertension, cardiac problem, surgical operation? Do you have any family history of similar condition or medical problem? What about your drug list? Then the concern at the end before 2 minutes, 2 minutes before the finishing the case or finishing the station. How to approach examination for this patient? I will start with the hand examination for sweating, pulmonary edema, and for tremors. Make the patient to extend his hand in front of him to see if there is any tremors. I'm going to see if there is any clapping for the patient for thyroid acropathy. I'm going to check the pulse for the patient for tachycardia or bradycardia. Then the arms, I'm going to examine the arms against resistance for proximal neuropathy. The neck. Then I'm going to sit down in front of the patient to check for neck and eye. The neck I'm going to check to inspect for the neck limb, for any scars, for the diffusion of the limb. I'm going also to order the patient to take a sip of water and to see the movement, to inspect for the movement of the limb. The eyes. I'm going to inspect the eyes for exophthalmos, which is a rim of sclera above the lower eyelid. I'm going to inspect for the lid retraction, which is a rim of sclera below the upper eyelid. And we can see here, this is the, as we said before, here, the exophthalmos, the rim of the sclera above the lower eyelid. So this is the exophthalmos of the patient, and this is the lid retraction. Exophthalmos, and this is the lid retraction. The rim of sclera above the lower eyelid, this is the exophthalmos, and this is the lid retraction, the watch of the sclera below the upper eyelid. And then I'm going to do eye movement. Eye movement here by two actions. By cross, okay, cross finger finger movement, and by crescent backward finger movement. This is the patient in front of us. I'll tell him, please follow my finger, and if you felt any double vision at any time, please tell me. Then I'm going to move my finger like that in crescent shape, crescent pattern finger eye movement, and make the patient to follow your finger. If there is double vision, so it means that there is optic nerve compression or there is external ophthalmoplegia. Then crescent shape, uh, this is a crescent shape, then this is the cross shape, then the crescent shape. Crescent shape means that C finger movement, or the letter C finger movement for lead leg. This is the patient in front of us. I'll tell him, this is my finger in front of you, please follow my finger. Then I'll make my finger C-shaped backwards like that. This is a C shape, but it will be in front of the patient to see the lid retraction. You will see the lid retraction here. When the patient is looking downwards, you will see the watch of the eye sclera for the patient. Again, so eye movements by cross finger movement, and ask the patient to follow your finger. If he see double vision, please to tell me. Crescent backward or C finger movement for lead leg. Okay, make the patient to follow your finger while you are moving your finger in crescent shape. If there is rim of eye sclera seen with the eyeball moving downwards, so the patient has lead leg. Now I finished in front of the patient. I'm going now beside the patient laterally to see if there is eye protrusion. Then I'm going from behind the patient. I'm going from behind the patient. What I'm going to do behind the patient? I'm going to palpate the lamp. Then palpate the lamp during swallowing the sip of water. Order the patient again to swallow a sip of water and palpate the lamp during swallowing the sip of water to see if there is or to feel if there is limb movement. You can palpate for lymph nodes um, if you are suspecting lymphadenopathy, or maybe the patient has extension of the limb or metastasis if there is cancer. Then percussion, while you are still behind the patient, do percussion of the upper sternum for retrosternal extension. Then auscultation of the mass or the limb for Puree. Examine the lower limb examination for pretibial myxedema as one of the triad of Graves' disease, pretibial myxedema, Graves' ulceronopathy, and thyroid necropathy. I hope I made the examination easy for you. Don't miss anything of this examination at all. Hand examination, arm examination, neck examination, eye examination, inspect laterally for eye protrusion, from behind, do palpation of the lamp, palpate the lamp with swallowing a sip of water, palpate the lymph nodes, percussion of the upper sternum for retrosternal extension, auscultation of the mass for Puree, lower limb examination for pretibial myxedema. Concerns. The concern, of course, he will ask you what it could be, doctor, this neck gland. If the patient has hyperthyroid symptoms, so you have to tell him that most probably you have enlarged hyperactive gland called thyroid gland located in the anterior surface of your neck. This gland seems to be secreting a lot of hormone called thyroxine, which is controlling or responsible for the activity of all the body systems. What we are going to do for you is to do for you partial blood test imaging of your neck to confirm our diagnosis, and then we refer you to a gland doctor to give you the appropriate management plan. At the time being, you have to stop smoking because it can worsen your eye symptoms, and we can give you some medication to slow down your heartbeats until our diagnosis is approved. What it could be, doctor, if it is hypothyroidism, the patient, for example, received radioiodine therapy, and then he developed hypothyroidism. He can bring you a patient with hypothyroid graves with hypothyroidism post radioiodine therapy. Most probably you have enlarged hypoactive gland called the thyroid gland, which is located in the anterior surface of your neck. This gland is responsible for the activity of all the body systems. What we are going to do for you is to do for you first a blood test and imaging of your neck to confirm our diagnosis, and then we arrange another appointment to discuss the result with you, and we are going to refer you then to a gland doctor to give you the appropriate management plan. Is it serious condition, doctor? I'm sorry to tell you that it is serious condition if not treated, but we are going to control your condition and to give you the appropriate treatment to control your disease and the regular follow-up in the outpatient clinic. Then the examiner is going to tell you what's your finds in the case. You have to tell the finds, the positive finds with the case. This patient, you have to tell the examiner about the thyroid mass or the neck lamp. This patient has thyroid enlargement, which is diffuse, um, fair, irregular edges, ill-defined, ill-defined irregular edges, mobile with swallowing, not tender, pulsatile or with Puree if there is Puree, with no retrosternal extension. The patient has, you have to tell the examiner about the symptoms of the hand symptom of the patient if he has pulmonary edema, thyroid acropathy, or he has tachycardia, or about the pulse rate of the patient if the pulse rate is tachy or brady. Then to tell the examiner that the patient has proximal neuropathy or not, and to mention the ophthalmopathy symptoms if the patient has exophthalmos or lid retraction or lid lag or ophthalmoplegia, double vision. You have to mention all the positive symptoms of the patient and don't forget about the pretypian edema. He will ask you what investigation you are going to do for this patient, doctor. I'm going to do investigation in the form of basic investigation, CBC, electrolytes, kidney function, liver function, inflammatory markers, and I'm going to do a specific investigation in the form of autoimmune profile for anti-thyroid hormone receptor antibodies, anti-thyroperoxidase, and anti-thyroglobulin antibody. And I'm going to do ultrasound, thyroid ultrasound, and scintigraphy for radioiodine uptake, and maybe fine needle aspiration if the case is euthyroid or a uh, cold nodule. What treatment you are going to give this patient? Non-pharmacological treatment in the form of patient education counseling, psychosocial support, occupational support, pharmacological treatment in the form of symptomatic treatment, beta blocker to slow down the heartbeats, for controlling the rate of the patient, and I'm going to give specific treatment in the form of carbimazole or borbithuracil, and the regular follow-up of the thyroid function test every 4 to 6 weeks, radioiodine ablation, can be one of the treatment or one of the options of the treatment of Graves. Surgery sometimes can be needed in some cases with large goiter or coexisting thyroid nodule. And eye treatment in the form of eye drops and lubricant, sleep upright, lateral tarsorrhaphy, smoking cessation, prism glasses in cases of diplopia. What if the patient has Graves' malignant exophthalmos? Graves' malignant exophthalmos means that the patient has optic nerve compression. So the treatment at that time can be in the form of systemic steroids, orbital decompression, and radiotherapy. These are the most common questions asked in the exam for Graves' disease. He can ask you as well, what if the patient is receiving, what advice you are going to give for the patient if the patient is going to receive radioiodine. This patient has to, if he meets patient, pregnancy has to be absolutely contraindicated. The patient has to be away from children or pregnant women for 2 weeks at least. Then the risk of developing hypothyroidism with radioiodine. The most common questions asked in the exam, very frequent case in the exam, and very easy case to get the full mark in the exam. Graves' disease. Nick Lamb if the case is Graves' disease. We are going to discuss later Nick Lamb if the disease or if the case is lymphadenopathy, which is less common. Thank you. My best wishes. See you in the next cases, inshallah.